Before we get started, however, I have some housekeeping that I'd like to review with everybody. My job today is to help facilitate your questions and to help give you a sneak peek of what a day in the life of an Aspen Dental endodontist looks like. So I want to encourage your participation. At the bottom of your screen, there's a Q&A panel box. That is where you're going to submit all of your questions. So the great thing is you'll just type in those questions. I'll see them come up. I will go ahead and ask our panelists the questions that you're typing in. Some of you have already sent in some great questions upon your VIBE enrollment and registration. So that's a great start for us. Let's go ahead and get to our introductions. Dr. Weldon.
Hi, I'm Dr. Weldon. I graduated from NYU College of Dentistry in 2010. And then I did my general practice residency at the Manhattan VA. And then I got into the Endo program there, which is 2 years. And I graduated from there in 2013. I've done dentistry in community health centers. I've done private practice endo. I've done hospital dentistry. I've done obviously corporate dentistry. And, you know, I've seen a lot of different things, which I realize has now been a long period of time since 2013. So if you have any questions about comparisons of different types of dental practices, I can definitely be here to answer those questions, in addition to hopefully other things.
Awesome. Thank you so much. Dr. Alex Mailer.
Hi, I'm Dr. Alex Mailer. I went to the University of Florida College of Dentistry, graduated in 2017. From there, I went to Nova Southeastern University, where I did a 1-year fellowship in endodontics, followed by a 2-year residency. I graduated this past June 2020. And after speaking to a lot of different private practice endodontists, different groups, I made the decision to join Aspen Dental, and I started working just 1 month after graduating this July 2020. And I've been very happy with my decision, and I've had a great experience thus far, and I'm glad to answer any questions that anybody has.
Great. Like I said, today's goal is to be able to have you ask questions to better understand what it's like to be an endodontist at Aspen. And these two folks here today are going to be great resources to help you through the next hour. Again, just a brief introduction. My name is Christy Bashwinger, and I work in field operations. I've been with Aspen Dental for 22 years. My passion has always been in supporting doctors and the practices. So I would love to go ahead and get started. Some questions are coming in, which is great. Again, the Q&A panel at the bottom of your screen is going to be the easiest way to go ahead and communicate. So let's start off. We're going to try to group questions into sections that make as much sense. So forgive me if we're jumping around a little bit, because I'll be asking questions as they pop up on my screen here. But for some of the questions that came in upon registration, one of the very first things that somebody asked was, how does an endodontist create their schedule, and how do the referrals work? Who would like to take that question?
I could start.
Okay,
Dawn,
go ahead.
You want to go?
No, go ahead.
So coming straight out of school, I did work for the 3 years that I did fellowship and residency. And while I thought that I was getting quicker and quicker, when I set up my original schedule, you basically set up your times. I say how I wanted to see patients and what I wanted to do, and they would follow those time frames. And even in the first month, 2 months, I would change those time frames based on how everything was flowing, how I was acclimating, working with my assistant, working in the offices. As far as how the referrals work, it's great because every office that you go into, most of my work is coming from those offices. So I have some offices with 1 or 2 dentists that I work with, so they're able to call or text me if they have questions before, or if I'm in the office, we could have conversations that day and go over cases. From the referrals from outside offices, we always get the referrals beforehand, and those are scheduled accordingly. And if anything changes at any time, there's always a lot of communication with the front desk and the office managers to make sure you're seeing patients as you would like to, and so that everything is working for you.
Great. And do you find too, Dr. Mailer, that majority of the patients that you're seeing are actually their internal referrals from Aspen Dental?
the greatest majority of patients that we're going to see are the internal referrals. The offices that we go to do a good job of working with the patients and being able to work with you. And they want to help those patients as best they can to save teeth, to treat dental disease, and to do everything they can. And because those dentists are doing so well with the patients, they have a lot of referrals that they're going to be able to fill your schedule with. So you will never be showing up with an empty day, and they'll be able to do it that best works with you and the patient and the office. It works very well.
I just wanted to piggyback off of that. Yeah, most of the referrals are from the dentists at the offices, which is one of the great things about Aspen. You're right, you don't go in and there's just an empty schedule. But what I will say is I've been getting a lot of external referrals lately too, because there are not a lot of endodontists in these areas that Aspen has practices. So you're pretty much the only one for miles and miles. And where I'm from in Connecticut, some people don't want to travel more than 20 or 50 miles to the next endodontist. And plus, with Aspen, the good thing is a lot of the patients that are there like to stay there. They don't like to go, to an outside person. They like the person at the front desk. They know the manager. It's all internal. I find is a lot better for patient comfort.
Perfectly stated. I will say hit on a few great points, right? The collaboration with the office teams and the general dentist at the Aspen Dental practices. But Dr. Weldon, you bring up a great point, the external referrals. That comes, I think, as you establish yourself in these locations amongst all the different Aspen Dental offices. And additionally, through a lot of insurance participation in networks that you are now part of. So I think that helps to grow your endodontic business pretty quickly as well. So great. A great question came up and it said, it says, this will probably come up in the session today, but please explain how Aspen Dental works. There's a few areas on this one, such as traveling between offices, which seems to be a pretty common question amongst a lot of folks who are not familiar with Aspen, carrying equipment and supplies. Let's go ahead and go with Dr. Mailer on this one first. And then of course, if there's anything, Dr. Weldon, you want to add.
Sure.
So I typically travel somewhere around 30 to 40 minutes would be my average travel time. I have 8 offices that I cover right now, and most of them are pretty close to my house. I'd have to say that most of the people that I know, whether it's dentists, doctors, physicians, any job, you're not really going to be 5 minutes from your house anyways. And while I'm not going to the same office every single day, most of those drives are very manageable and pretty easy. I have many friends who will drive 40, 50, 60 minutes on a day. So it's not uncommon if you have any job to travel a little further. As far as taking equipment and doing everything, I have a fantastic assistant who will always pack my things up and set everything up. So while I bring the materials back and forth, it's being put in and out for me for all of that. So that's never really an issue. And I really have had no problems with any of that. Also, I use Aspen has a great plan with the car. So I use the Aspen vehicle as well that they provide. So if you join and they have that program, the car that I'm using is also supplied with Aspen. So any of the miles that you may be worried about, or the driving, the insurance, the maintenance, is all covered under that plan as well. So it's a very great system for them to facilitate it as easily as possible for us.
We try to make it as easy, that's for sure. Dr. Weldon, anything to add, or did Dr. Mailer, do you think, cover it pretty well?
I think that's pretty much everything. But I'm trying to remember the question itself. Did they ask about supplies specifically?
Oh, they did,
like
actually. Yep,
ordering?
it said traveling, carrying equipment, and supplies.
Yeah, I've never had any issue with actually getting a specific supply from Aspen. People always say, oh, well, don't they want you to buy this thing or that thing? But I get always the best files. I choose the best rotary. I get exactly the obturation system that I want. I've had mine break many times. I don't know if you've been on those emails. And I'll have a busy week the next week, and Aspen will get that overnighted. It'll be like one day where I might not have it, and I'm not even working that day. So I've never had an issue getting supplies. I always get what I need. And there's a great support staff behind the scenes that I think a lot of us don't really realize actually exist.
Perfect. I think the partnerships that we have with the suppliers and Henry Schein and all of the, it really helps to expedite that. And that's why we're able to be able to get that as quickly as possible to you when the need arises. So some great questions are coming in. So let's see here. I think this one was already answered. It says, as an endodontist, are you in your own endodontic office, or is there also a setup for multi-specialty practice? Dr. Weldon, would you like to go ahead and answer that one?
I think that I understand the question in the way that I'm going to answer it. Every office that we go to is technically a general practice office, and we are the endodontist that comes there to see the endodontic patients. Same thing with the oral surgeons. So it's not like you will never see another endodontist in that office. It's just you. And you oftentimes, just because of scheduling, won't see the oral surgeon there on the same day either. I don't know if that answered the question.
I think it's beautifully answered. In fact,
okay.
I think the fact that we can guarantee an exclusive territory to our providers, our specialists, meaning that, as Dr. Weldon just said, we'll never hire another endodontist that would be allocated to the same location. So you're never competing with another endodontist. Those locations are specifically provided to you to be able to travel amongst and do endo in. And it is, of course, a GP practice that you're immersed in every single day that you're working for Aspen. So great. This next question, I think, is a pretty popular one. In fact, a lot of questions about dental assistants. You both touched upon it briefly, but it says, hi, can you talk more about the assistants? Are they from a specialty pool? And are the assistants going to be changing from day to day? Dr. Mailer?
I love my assistant. She's fantastic. She's very reliable. She actually, I'm down in Florida. She worked in private practice endodontics for a few years in New York City. And when I came down, she had been working with someone else with Aspen, and she was already trained, already great. And she goes with me to every office that I go to. We drive separately. We meet there, and we set up and break down and do the whole day together. So that's the consistency that I get every single day. Anything that I've had to do with her specifically or individualized training based on what I like to do or how I like to work has been very easy. I go over it with her. We do it one time and it's set and it flows very well.
Perfect. This one here is, I think we touched on this one too. So we're seeing a little bit of repetition, and forgive me if some of this comes across as being repetitive, but I want to be able to get to these questions. This one's a little more specific about equipment. It says, are the hand pieces swivel based, and do the endo chairs come with an armrest?
I think it depends on the office. Different offices have different chairs. Like some offices are newer, some offices are older. I can't say specifically that mine do have a swivel handpiece. And I don't think they have the armchair rest, but I'm sure if you had a special chair that you wanted, like one that the practitioner sits in, I'm sure we could figure out how to get that ordered, and then you could just carry that around with you, or maybe it's an attachment you could put on, because I do have an attachment for my apex locator on all of the chairs, and we just take that off and put it on at each office. But I'm sure that's something that could be addressed easily.
Perfect. This is along the lines of equipment. A lot of questions are coming in specific to equipment. Do you have a CBCT and microscope with you in each office? Dr. Mailer, would you like to go ahead and answer that one?
I believe this is also, like what Dr. Weldon said, specific to each office. I know that every single office that I go to has a CBCT, and I have the ability to take a scan anytime I want. If it's something Sometimes we will charge the patient based on where they're coming from, what the exam is. If it's ever in the middle of treatment, or if I ever feel that I need it, I can easily take the scan. They're very happy and accommodating. Even if the machine is going to be used, they'll make room because they know that I'm just going to go in, get out, take the scan, and be able to use it. In that regards, that I'm very lucky. I have an office that I'm at that they just built a new office. One of the places I go to, and again, they built that with the CVCT. So it makes treatment a lot easier, and the technology just keeps on increasing in each office. And I know that there are more changes, at least where I'm working, that they're going to continue to modernize and increase technology, but they have everything that I want in that respect.
Perfect. I can also speak quickly to this one. Prior to COVID, the intent was to have every Aspen Dental office retrofitted with CBCT technology by the end of 2020. Now, obviously, things got um, a little bit out of off schedule. So now the prediction is that we'll have this done by the completion of 2021. However, every brand new location that is being built now, and actually it started last year, is being equipped with CBCT. So eventually, I think that this will just be standard in every location, as our goal is to always be able to have the latest technology in each facility. So great questions. Looks like people are definitely acknowledging that we're getting to a lot of their questions. Specific to the microscope, obviously, Dr. Weldon, would you like to speak to the fact about how the microscope works, and obviously the setup in each of the offices with the stand?
Sure. Each office will have a stand for the microscope, and the portion of the microscope that you actually, where the ocular part is, and basically the small arm, which is maybe approximately 2 feet in length, is the portion that is able to be taken with you to each office. So you can therefore have a microscope at each office. It takes like 5 seconds to screw in and plug in. So you do have a microscope at each office.
Great. You're actually right. The stand is there. You're traveling with your optics in a nice secure case. Okay.
Yep.
Yeah, and I would just like to add on to that for just a moment. If you don't want to use a microscope for whatever reason, no one's going to pressure you to. If you want to use a microscope, I personally believe that that's one of the biggest advantages we have as endodontists. I use it all the time in every office. I never use loops. But yes, they definitely provide the microscope. And if you want to use microscope all the time, that's what most of us will be doing with Aspen.
Great. All right, I think we've answered a lot of questions specific to equipment. Now we're seeing some questions about, what types of procedures an Aspen Dental endodontist is primarily working on. I'm sure that it's different for many, but would you like to speak, Dr. Mailer, about the type of procedures you're doing and what your schedule might look like week to week?
Yeah, so I am seeing somewhere between 6 and 8 patients a day would be my normal schedule. Most of the cases that I'm going to be doing are first time endodontic therapy. I personally like to do a lot of retreats, so I've talked to a lot of the dentists that I work with. And anytime someone comes in for retreats, and I get some referrals because I'm doing that as well, because some people don't do retreats. I do a lot of the referrals I get from outside would be for retreats as well. And I like to do surgeries. So I've done a number of apicos since joining Aspen as well. As long as you tell the office like what you're comfortable with, how many you'd like to see, what you'd like to do, they're going to make that schedule a reality for you. It's very common for me to come in and be able to see my patients very smoothly. They're not going to put any pressure on you as far as what you're doing, but I say, look, I would like this to be my schedule as far as times with patients. So I do molars or premolars or anteriors in a specific amount of time. If there are patients that come in that need multiple treatments, often I'll talk to the office managers about how or what to adjust the time based on what procedures on those patients. Anything that I'm doing a retreat or surgery, I always do a consultation first, so we have the appropriate amount of time. But it's very easy to see whatever number of patients you're comfortable with or would be willing to do. That's probably what's going to be your schedule, because they'll be able to make that happen.
Sorry, I just wanted to piggyback off of what you said, which is super important, is the amount of communication you have with the offices. I am constantly checking my schedule to see, how they've scheduled patients. And yes, you should definitely give each office manager, a time thing. Like, so this much for anteriors, this much for premolars, this much for, I forgot what I said, but you know what I mean.
Sure.
And the point is, though, also is that I actually have started to ask for the x-rays and whatnot of all of the cases that I'm supposed to see, so that I can say, okay, this molar looks like it's, got super curvy roots. I'm going to need 2 hours for this, as opposed to, whatever it normally is. And just with the previewing of what the x-rays look like, I can better schedule how the patient should flow that day. So like you said, your day goes smoothly, because endo is hard enough, just doing it. It's another thing when you have patients waiting because it wasn't scheduled right, or, is this really a consult, or is this is this a patient that wants to get the retreat done that day? If you know these things beforehand, it really helps your day and your psyche.
Yeah, and the beauty too is Dr. Mailer will recall, because he's been on the team for just about a year. Of course, Dr. Weldon, you've been here for going on 8. So when you join Aspen Dental, you're assigned a onboarding partner, somebody from the specialty support team, to kind of guide you through all of this process, right? To help you create a landing page that would communicate to the offices that you're traveling to on the amount of time that you need per procedure. Dr. Mailer, you mentioned earlier that you were able to adjust those times after your ramp up period and after you got really well acclimated. So just know that behind the scenes, there is a lot of support that our team will also be providing to help communicate and facilitate those schedule guidelines, I guess you would call them. So great. Let's see, a question came up. This one is, I think it's going to vary, but it says, since you're traveling to different offices, who's responsible for scheduling? I think we may have already touched upon that. And do they schedule the same office by chance 2 days in a row, or is it always a different office each day? Dr. Weldon, why don't you grab that one for me, if possible?
Sure. I basically do my schedule a month in advance, and I give it to the offices. If an office has a lot of patients and we're not able to accommodate them in that one day, we add another day to try to accommodate as many patients as possible. I guess if you know that, like, say, the office in Timbuktu often has, a ton of patients, then maybe in future scheduling, you'll schedule 2 days for Timbuktu. It's up to you if you want to do it 2 days in a row or not. I would say, just in terms of patient management, it's probably better to space it out, just so that in case there's a problem with the patient, or you want to see a patient for a follow-up after maybe an APICO or something like that, that you've given them time to heal before you come back to that same office. But it's really up to you. Basically, you can do it 2 days in a row if you want to, but I don't typically do that.
Perfect. Dr. Mailer, anything to add to that?
Yeah, I think that what Dr. Weldon had said before with the communication, and I think this is going to come up, because of the support that we have at Aspen, if anything needs to change, it can flow very easily. I do my scheduling of days with the regional manager in the biggest area that I'm at. So we'll go over what days off do I want, how do I want to run my schedule, and we'll go over how often we'll go to certain offices in a month. We recently changed how we're doing my scheduling a little bit, so we kind of schedule by weeks instead of by months to keep it flowing more, because some months will end in the middle or start in the middle or end at different times. And I do have one office that is a lot busier, so I do hit that office one more time than the rest of my offices, because we know that it is going to be needed. After I have those set schedules, as far as the days at each office, all of the dentists and the office managers with any questions or any scheduling questions, concerns, anything, will text and call me, and it flows very easily. So either in the morning before, or at night on the way home, or sometime during the day, we'll be able to communicate back and forth to adjust as needed.
Great. I think what I'm hearing from both of you is autonomy, right? You have the autonomy to decide which days of the week you choose to work as an Aspen Dental endodontist. You have the autonomy to decide which locations, like the further locations or the closest, that you want to visit at what points of the week or the month. And you also have partnership. You have great field partnership with all those folks out there running the offices day to day that understand the patient demand and the things that could really help to facilitate strong patient schedules for you. So I think autonomy is key here, which is great. Let's see here. A question came up about emergencies. I think Dr. Weldon, you may have hit on it, and then a question popped up, and it said, it popped up in a different form, so forgive me. Again, use the Q&A function if possible, but it did ask about how you would handle emergency situations from patients, and what our protocol is to address those. So patient emergencies.
I have the phone number of all of the general dentists at every single office that I work with. I also have the manager's phone numbers. Anytime there's a patient that comes in with a flare-up, they call me right away. They text me, I get back to them, I let them know what I want to do. If it's a very serious thing, such as, I don't know, if it's something where I need to refer to an oral surgeon, obviously Aspen has an oral surgeon. They can tell you what office they're in. I have all the oral surgeons' numbers. I can text them, hey, can you look at this? This is a swelling, blah, 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 incision and drainage. But sometimes it's as simple as antibiotics and pain medication. But all of the general dentists that I work with are very capable of dealing with, any sort of flare up. If it's something above and beyond, like I said, they will definitely contact me, or they may send the patient to whatever office I'm in. My offices are spread apart, but a lot of them are fairly close together. So, if they have to travel 15 minutes to the next town, I'm right there. I'm ready, willing, and able to see them. And that also goes to the fact that when you're doing your scheduling, you kind of want to make sure you're always in a certain area, a couple times a month, just in case there are those flare-ups, because you don't want a patient to have to travel more than an hour to see you, but that's a little more nuanced. I don't know if I answered the whole question.
Oh, Doc, I think you did a beautiful job. In fact, I think it solidifies that there's multiple options or avenues that you could take as it relates to the care of emergency situations. So having locations throughout the area that you're traveling amongst makes it easy for the patients to be able to get to you. And the telemed service that we provide, which is obviously after hours situations in the event of a patient emergency, is also just another way to give the patients peace of mind. So great. A question came up, and I think we could spend some time today talking, especially because we're still in the thick of it here, about COVID. It says, I'm not sure if this question was addressed yet, but could you talk about any COVID-related safety measures that were implemented and what your experience was with PPE? I'm going to actually ask both of you to answer, because each of your experiences, I think, are really important to hear, because it was such a difficult time for a lot of folks in our profession. So let's start with Dr. Mailer, if you'd like to, again, address COVID-related safety measures and then your experience with PPE.
So I joined amidst the COVID pandemic, and when I came to work, I never had any problems or issues or concerns with safety or PPE. Every single office was always stocked, whether it was gowns or gloves or masks or N95s. The offices were all set up. If you wanted to make any changes in scheduling or any adjustments to don PPE or to do anything like that, you have the autonomy to do whatever you feel comfortable with. I just really never had a problem at all. Every office is taking temperatures. Every office is pre-screening when they're scheduling the appointment, when they're confirming the appointment. I have had the occasional patient who would cancel or would come and we would catch it. I haven't had anyone come into my chair that I was concerned with, but I definitely do have patients that they've got to on the phone or at the front desk before I see them, where either they don't feel that great or they're running a fever, or maybe they traveled and they didn't say it before, but at some point it will come up. before it gets to my chair. And as far as everything that I work with and my assistant, we've always been very well protected. And if there's any concerns that we have, or if there's any people that come in through the door that you're not comfortable with, there is no questions asked. You are able to send them home and reschedule them if you need to, and come back and live to treat them another day. And that's totally okay.
Absolutely. And then the follow-up question to that was about the PPE. Was there any points where you were stressed or concerned about PPE, Dr. Mailer?
Never. Every single office is very well stocked. There's never been a problem or need to get more or different or anything. If there's anything that you want, Aspen is very good at procuring anything. And I really mean that. But no, every office has been very well supplied that I've gone to.
Thank you. Now, Dr. Weldon, you were part of, I think, perhaps a committee or a call. You helped participate and represent Aspen Dental Endodontist during the midst of the most difficult times with COVID. Can you talk a little bit about that? Again, the safety measures and the process behind your perception of PPE?
Well, I just want to echo what Dr. Mailer said. I've never had any issues getting PPE. I have a lot of friends who have their own offices outside of Aspen in different parts of the US who have had extremely difficult troubles with getting PPE. I mean, maybe they just get the mask, maybe they don't have the shield, et cetera, et cetera. Aspen's always had that. And they have a lot of it, which I think is great and speaks to Aspen's ability to procure things. With regards to COVID, I think that it really made us look at scheduling a lot more closely. We want to make sure we have enough time for that patient, and we want to make sure we have enough time for cleaning the room, doing what we need to do, wiping everything down more than once, spraying the air, all that jazz. But I think with COVID, it just came down to scheduling and making sure that we felt comfortable with the amount of time that we had with the patients. And Aspen was very receptive to that. I also don't like to have a lot of time just to be in the office. I want to get in, I want to see the patients, I want to do what I need to do and get out, because I don't like wearing all that PPE. and the reason why I'm gasping is because I wear an N95 mask all day. But back to what I'm saying is it really came down to scheduling and just making sure that the schedule worked with what we needed to do for the extra safety precautions and making sure that we adequately treat our patients. Other than that, I mean, there's no real difference. We still treat our patients the same with COVID or without.
You know, one thing I'll mention, just to highlight and spotlight the Aspen Dental Specialist within our network. You know, when things got really difficult in March of last year and offices were forced to really go down to following the, you know, state by state guidelines and restrictions that were imposed on our business, the specialists at Aspen Dental, I would say probably 90% of them continued to be, you know, employed the entire time. They continue to show up and service patients on an emergency basis. So oral surgeons and endodontists across the Aspen Dental Nation really have been taking all the necessary precautions, securing all the PPE. We even went so far at one point as to send N95 masks directly to all of our specialists' homes, so that in the morning when they were getting in and starting out their day and traveling to a new location, there was always peace of mind knowing that you had what you needed to be safe for the day. But again, I just want to thank both of you and all the other specialists. There's nearly 140 of them throughout the Aspen Dental Nation that continue to service patients and help them during this very difficult time. So I'm really proud of that.
Thank you for the N95s, by the way. I did get that box.
Absolutely. It's our pleasure.
Good
our
peace
pleasure.
of mind.
So this is a long question and it's geared to Dr. Weldon. It says, Dr. Weldon, so we're going back to workflow a little bit here.
Okay.
Can you talk more about your workflow, specifically from the aspect of previewing the cases beforehand and communicating with the offices on how much time is needed? What do you what do you use when you see a case that may take more time than is needed for the rest of your schedule if it's already booked out? So I guess it really, in a roundabout way, it's asking about how do you adjust to those atypical situations, and how do you communicate it?
Um, so like I said, I have the number and information for everybody in the offices, and I ask them to send me, preferably via email because it's encrypted, all of the x-rays so I can see what I'm dealing with. If it's a patient like that's been put in, the day before and I wasn't able to see that, and maybe it's like a 3-rooted lower premolar or something like that, and I get in that day and I say, okay, I'm going to need more than the allotted amount of time that I have. I will go to the front. I'll speak with the manager. I'll say, listen, I'm going to need X amount of time for this patient. I know I have another patient coming in. Can you call the patients and kind of move them down a little bit, or can we reschedule the patient that comes after? Because you don't want to be stressed while you're doing these cases. It's stressful enough just dealing with patients in general. So I would just say, just communicate with the front desk. If it's something that you don't think you can deal with, or maybe you get in there and you're having issues and they weren't able to reschedule that other patient, just have the patient come back, calcium hydroxide, talk about post-operative situations, and make sure that the patient's scheduled again for you, because you don't want the patient to think it's done, because that's happened before.
Yeah.
Make sure the patient's rescheduled with you and understands that it's a difficult case. Make sure when they reschedule it that they give you enough time. It's all about communication and planning ahead of time, because it will save you a lot of headache.
Coming from a field operations background, Dr. Weldon, I can say to you, I was in office management roles all the way up to regional management and director roles. And that's exactly right. You have an army of people at each location, multiple folks at the front desk, and very skilled office managers to handle those conversations and address any late schedule changes that need to be taken care of. So just know that if those situations do arise, we're all working on a collaborative basis to go ahead and make the patient experience the best, because that's exactly what it's all about, is giving our providers a good day at the office that day, and obviously making sure the patient's experience is optimal as well. So good. Some questions have come up specific to compensation, and obviously our compensation model, I think, is difficult to perhaps really define on a call like this. But I guess when on the topic of compensation, Dr. Mailer, being new to Aspen, coming out of residency, and coming to Aspen, let's just talk a little bit about your experiences with your compensation structure and your overall. Are you pleased with your compensation, and how are you doing so far?
Of course, I think, first of all, everybody at Aspen, as far as the endodontists here, are going to be salaried employees. So we're W-2, we're not 1099. And I think one of the great things with Aspen, even though what Christy's saying is it's hard to talk about over the phone, how the structure works, it is very open and it's very transparent. I have friends who've been working for a few years or many years, and they talk about joining some of these private practices or groups, and it's really hard to get where the numbers are coming from. That's never going to be a problem here. Any question that you have, you can either find yourself, because of the specialist reports, the patient reports are always going to be available. You're able to check out any of the records that you've worked in. And if you have any questions, there is a team of people that you can message or email, and they will look at that, whether it's from a patient perspective or insurance or accounting. It's very easy to see where everything is coming, where everything is going. So you're able to see absolutely every dollar that's spent, that's either going to come to you or where it's going. So I think from that perspective, it's fantastic, because you don't have to ever worry because of the high level of transparency. As far as am I happy with the compensation? I think that everyone wants to make more money. So in that sense, it's an interesting question. But yes, I am very happy with how I'm doing. Coming straight out of residency, I was working for the 3 years before I did complete my residency. But yes, I'm very happy. I'm very comfortable. And since I'm at the beginning, I expect it'll only get better and easier. But I definitely have to say that the level of transparency is a definite bonus of being with Aspen.
And I think too, Doc, one of the things is when you do have questions, you don't have to spend the time away from patient care to do that research and to try to figure those things out, or look at insurance, reimbursements and all of those things. The goal with being an Aspen dental specialist is to be able to dedicate your entire day to clinical dentistry, to focusing on patient care, while we're behind the scenes, Aspen Dental Management and our support team, to go ahead and take care of the business aspects, the necessary things that are required to run a dental practice and a successful endo practice within the Aspen network. So great. Dr. Weldon, you've been on the team, obviously, several years. Would you like to speak in general terms about your feelings about your compensation structure here at Aspen?
I'm extremely pleased with my compensation with Aspen. Like I said, I've worked in other settings, and sometimes you don't get paid. Sometimes it's questionable as to, is this equity that you have in the practice? A lot of times they don't have a formula. Aspen has a formula. Anytime I've had a question about insurance, like you were saying, there's a whole team behind that. You don't have to deal with, insurances asking questions about procedures. Aspen has a group that, like, for example, if you do an incomplete endo and the insurance denies it, you don't have to spend your time dealing with that. All you have to do is just basically send your notes over to the people at Aspen and they take care of it. Like, that's one thing I will say is we don't have to deal with any of the front desk stuff. We don't have to deal with insurances. We don't have to deal with financing and things like that. All we have to do is take care of the patient, do the root canal, make sure the patient has a good experience. That's it. And that's one of the reasons why I like Aspen and would never want to own my own practice, to be honest.
Yeah, you hit it perfectly. And you and I talked earlier today about, coming out of being a newer endodontist and maybe joining an endo practice. You had said that you have perhaps heard of situations where, those newer folks are getting they're not getting a full schedule. They're challenged to be able to get good reimbursements on their procedures and things of that nature. So I think that there's a lot of, positives here. So thank you. In addition to compensation, questions have popped up about benefits, and all the way from Dr. Mailer, you mentioned the CAR program, right? Full-time specialists that are traveling obviously would be awarded the opportunity to participate in a company CAR program with a leased vehicle. So that's one of the benefits. Somebody here asked, does Aspen Dental cover your malpractice insurance? Dr. Mailer, we'll shoot that one over to you.
Yeah, I chose to keep my own malpractice plan. I liked the policy that I had for the last few years, the type of policy and everything. Aspen will reimburse a specific amount and we get paid each month to contribute towards that malpractice. You have the ability, as long as there's the proper coverage, you can use a policy through Aspen or through yourself, and they will reimburse you that specific money through it.
Yep, perfect.
For sure.
Mm-hmm.
In addition, so we have two situations here. We have Dr. Mailer, who's full-time, and we have Dr. Weldon, who's part-time currently. There are benefits for both categories of employment at Aspen. So for instance, medical insurance is available to both part-time and full-time employees. The full-time benefit package at an interview process would be able to be outlined for you specifically and shared with you, as well as the specific details of the compensation structure, because it's a calculation that I think is a little bit challenging to review today on a call like this. So I think we may have already touched upon this one, but an important question that had come in earlier. Did you join Aspen Dental straight out of residency? And do you feel like you were prepared to take on difficult cases? Now, Dr. Mailer, we know you did. Let's ask Dr. Weldon this specific question, if you can elaborate, coming out, if you can rewind and think back to that time. Did you feel comfortable coming, and the types of cases that were being scheduled for you, were you comfortable dealing with them?
I was comfortable. I found it important to talk to the general dentist, like I said, to find out what sort of cases they were going to be scheduling so that I could have a specific amount of time so that I would feel comfortable. I mean, for me, it's all about scheduling. I mean, when I was first coming out, could I do it in an hour? Maybe not. Maybe I needed that hour and 30 minutes or 2 hours or what it was. But my comfort was attained by looking at the cases before I saw the patient and knowing I had enough time to do that. If I feel like I have that, then I'm comfortable. But that's just me. I don't.
Great. Now we know, Dr. Mailer, you did come straight out of residency. Were you ever challenged? Were there situations that made you uncomfortable, and how did you handle that?
I think sometimes as endodontists, we can get very focused on our little location under the microscope inside this tooth. What Dr. Weldon said before is very true. And coming out of residency, sometimes I feel like, oh yeah, let's do it. Let's get it done. I want to complete it. Sometimes you can't. You got to stop it. You got to medicate it. You
Yeah.
reappoint. I think for challenging cases, if you need to take more time, medicate it and scan it. That's why I was talking about the CBCT before. If you take a scan, you could see what's on the scan and choose to do it that day, or formulate a plan, take a step back, medicate it, talk to your dentist about, that you're going to reappoint it and deal with it then. One of the other benefits, and this was mentioned before, as far as patients, Dr. Weldon was talking about patients like to be comfortable in their own location. I think that because a lot of these patients are going to be direct referrals from that office, it's not like you have a patient who's never been to an office who's going to be upset if they get a call saying the doc is running late or we need to push you back. A lot of them have very good relationships with the staff at the office and the front desk and the dentist. So if I'm ever running behind, or if I schedule my normal time for a premolar and I have multiple canals on a tooth, I think is going to be a straightforward one canal case. They could call the next patient or the next few patients, and I'll be able to catch up without that pressure that I have a bunch of angry patients in the waiting room, because that rapport has already been built. So from that respect, a lot of it is the communication and the patient management. I agree with the scheduling, but it's important not to get too fixated and know that anything that you do, you could take a step back from. Nobody's going to be upset. No one's going to be pressuring you to do something that you're not comfortable with, or finish something that really shouldn't be done.
Can I just piggyback off of that, Dr.
Yes.
Mailer? I think that was a great point. That goes to the autonomy that you have. I mean, you pretty much dictate what your patient care is. And Aspen has never stepped in and told me I need to do X, Y, and Z. It is up to me. It's my license. They just try to accommodate all the patients as best they can according to what I say. And it's just super autonomous, especially with the taking of the scan, stepping back, reappointing the patient sort of situation.
Dr. Weldon, thank you, because a question pops up often about a hierarchy of people at Aspen Dental, or the perception that people are making our specialists reach a certain production number. So clearly, I think you both have stated that is clearly a situation that you decide how you're going to frame your day. You decide how you're going to treat your patients. You decide the cases that you will or will not treat. So you do have full clinical autonomy, which is great.
Yeah.
A message came up in the chat box. I think I saw it pop up that said, "Are you both planning long-term with Aspen Dental?"
Yes. I've been
Easy.
here for 8 years.
Yeah.
I have a great work-life balance. Like days that I do other things like real estate and stuff. Days that I'm not working with Aspen, I can do other things. And if you own your own practice, you have to deal with other things, hiring, firing, make sure that billing goes. I have lots of friends that own their own practice and they're constantly working, even on their days off, their admin days. And you don't have to deal with any of that. Like, you come in, your patient care, and that's it. Like, I mean, look, maybe you want to have, another child And that's what it would be if you own your own business. But that's not for me. So I have great work-life balance. Aspen works for me.
Aspen Dental Management's primary role is to care for the people that care for the patients, to take away that burden, to alleviate those day-to-day burdens of running a successful practice, as we stated before. So I think the fact that you can speak from folks that are in your circle of friends that are in the same profession that experience that, it's profound. And culture is really important at Aspen Dental. For those of you that participated in the opening session with Bob and Dr. Judge, I think it really speaks volumes about how we care for one another at Aspen. Dr. Mailer, let's say you're fairly new here, a year in. What's your long-term plan? Is this your long-term plan, is to stay here at Aspen?
So I can tell you that I haven't been here that long, but I'm very happy with my decision. We haven't really talked about it that much, and I don't know how much they mentioned it before, what people know, but Aspen is run like private practice offices or private practice groups. I happen to really enjoy the group that I'm with. I really don't do much social at all, but the few social things that I will do as far as dinners or hanging with friends, a lot of the dentists have become friends to me and to my wife. This morning, I was awake at 4:30 in the morning and I went fishing with two of the dentists at one of my offices. Because if I'm going, I know that they're being safe, I know that I'm being safe, and everybody gets along. Basically, 5 or 6 of the offices that I go to in my group are all people who are very much like myself. We get along very well. We all have fun together. And I think as we're all doing successful together, for me, that's my plan for now. I can't speak to my long-term plans going down the road. I can say that I do get other offers from private practices or general dental offices asking me to come in, and I have no desire to make that change, because it's not a better offer at this time. It's not something that will work better or set me up better. If I had another free day, I would spend one more day working with Aspen if that's what I chose to do, for additional work. I'm just very happy with the decision. So for now, I'm not making a change.
Music to my ears, that's for sure. I will say too, I feel like I'm part of a family here, a tribe, Aspen Dental Tribe, 22 years and going strong. I often say I think they're going to have to, really force me to eventually retire, but my intent is to also be here for the remainder of my career. I've had amazing experiences watching this organization grow from 12 locations back in 1998 all the way up to nearly 900 20 years later. So it's been remarkable. We're getting pretty close here. I can't believe that we've been talking for about an hour. We're gonna be wrapping up here in just a few minutes. But before we do, I want to ask perhaps one maybe last parting question. It came up on the registration questions. What is the most surprising thing you've learned that perhaps you didn't know before joining Aspen? I know we probably touched upon it, but was there anything that surprised you, Dr. Mailer, being that just a year ago you were in the same situation as a lot of the folks that are watching us today? Was there anything that surprised you when you finally took the leap and joined Aspen?
Yeah, it's kind of what I was just talking about as far as like becoming friends and what Christy said about making this your family. I'm very lucky with the group that I joined. Before coming here, I thought that private practice was the way to go, and I had a very specific view, or an opinion on corporate dentistry. I don't think that Aspen Dental fits your preconceived notions for a corporate group. It's like groups of private practices. Each office has their own autonomy. Each office and each owner and each dentist is able to do what they want to. You're able to do exactly what you want to. The only person who's ever going to pressure me to do something different or do a number of cases is myself. Everything that I'm doing, whether it's scheduling or patients, single visit, multi-visit, anything with treatment, is basically dictated how I would like it to be. So in that respect, I don't feel any of the pressure, but I do have all of the support of the company. I was surprised to learn that a bit of it before I started joining, and that's why I was considering it more, because a friend was the one that got me involved with this group. And now because of that, I know for certain that yes, it is like a group of friends, a group of family with a lot of support behind you who will let you do what you want and let you be successful the way that you want to.
Perfect. And I'll tell you, I'm sure in addition to the two panelists today, there are so many endodontists out in the Aspen Dental Network that for anybody that you may want to hook up with and have a conversation, or if you live in an area where there's a practicing endodontist, we are always try to help facilitate and coordinate an opportunity to meet these folks and perhaps go in and spend a little time with them just to be able to really see it firsthand and experience it. Dr. Weldon, and maybe to elaborate a little bit, because we'll be wrapping up here in just a few minutes, but for folks who are contemplating their career choice, they have big decisions coming up, in the next few months, or probably right now in the midst of it. They're going to have to be making some decisions about what career path they're going to take, perhaps a dental service organization, a private practice. You touched on it earlier, since you have experience or perhaps more exposure to folks in different sectors. Could you maybe elaborate on some of the differences or the pros to considering Aspen Dental as a career choice?
I would say with Aspen Dental, you're the only endodontist there, and possibly the only endodontist for miles and miles away. So everything is on you, and you get the unique opportunity to treat patients who often are not able to be well taken care of. I mean, they go to a general dentist, not that there's anything wrong with that, but they'll get everything done in that general dentist practice, and there's no endodontist there. Well, you're at Aspen up the street, they'll come to you. And I think that it's, I don't know, you get patients that aren't around other specialists, and that's kind of cool because they really appreciate what you do. And I don't know. I just think that private practice is great, but when you're just coming out of residency, you're going to get, a lot thrown at you because it's a new experience, but you're also going to be competing with all of the other endodontists in the practice, in the private practice, or you're going to be at a general dentist private practice where A, they probably don't have a microscope, or if they do, it's not a good one, or B, they give you some files that they tell you you have to use, which are not that great. And, Aspen, you order whatever you need. There's no issue. I feel like Aspen gives you all the tools that you need to do a good job. You don't want to be concerned about your supplies. You don't want to be concerned about your schedule. You want to be concerned about the patient that's in your chair right there. And that's all you have to think about with Aspen. There's none of this other stuff, which is just, in my opinion, background noise. So that's why, I landed at Aspen. Private practice is great, but, there's a lot of drawbacks to that with the compensation, with the supplies, with, just in general, I think Aspen is better.
You touched upon something really that's impactful and important to me. It's the patients that we service. These folks need us so desperately, and we're there,
Yeah.
and we make it easy for them. When we say that we have a yes culture at Aspen Dental, we want to say yes to the patient in every way. Yes, we can get you in today. Yes, we can provide you specialty services right here. You do not have to go anywhere else. So I think that it's a pretty special structure and business model and culture that we embrace here. Now, are there any last parting thoughts from either of you doctors that you might want to add in the last moment or two here? And then I'll give some instructions for folks at the conclusion of our session today. But any last minute thoughts that you'd like to share before we move on to our conclusion?
I just think communication and just the team that we have working behind the scenes makes my job, dare I say, easy. And I find that at Aspen, and that's important to me because there are a lot of stresses in life. And, I just want to do a good job. I just want to take care of my patients. I'm able to do that with Aspen.
Awesome.
I
Dr. Miller?
totally agree. I think that everything that we talked about today may seem a little rosy, but I think that it's true. The focus is whatever you want to do, they will facilitate it from supplies to scheduling. I completely agree. Communication is a huge thing. There's a lot of preconceived notions about corporate dental groups, and before grouping Aspen into that, I think it's important to talk to anybody that you know that works with Aspen or for Aspen. There's plenty of people who will be willing to answer any questions either today or at another time. And it's important to keep an open mind and really see exactly what's going on, because there are a lot of things that may not be accurate, that that may be keeping you away from Aspen or the corporate job that we have here, that really is not what you would think it is. So I think it's really good to keep an open mind and realize that coming out of whether it's coming out of school or changing jobs, what you want to do is the endodontics and treating the patient. And what Aspen provides is a way for you to do that with all of the support behind you.
Yes.
Perfect. Guys, it's been a great hour. I want to thank our panelists, Dr. Mailer, Dr. Weldon. You are awesome. You made this hour really enjoyable for me. Hopefully the folks out there got a lot of their questions answered that they were looking to get today. Quick reminder for anybody that's going to be participating in any one-on-one interviews or conversations with our doctors, please be sure that you only enter your Zoom room 5 minutes or so before your scheduled time. So we'll be running back-to-back interviews today. So again, do your best to just enter right on time or no earlier than 5 minutes before your scheduled time. I just want to thank everybody for such great participation today. I hope that you've enjoyed your Vibe event so far and that the remainder of the sessions today go equally as well. So thank you so much. Have a wonderful day, and thank you for attending Ask Me Anything with Aspen Endodontist. Bye-bye.